We are very fortunate to have her with us today, Susan Mullaney. Susan is the president of Kaiser Permanente Washington, which is the newest 8th region of Kaiser Permanente. In this role, Susan leads this new region in providing high-quality, affordable health care to more than 680,000 members throughout Washington. Prior to joining the Washington region, Susan served as Chief Operating Officer for the Kaiser Permanente Northwest region, and from 2013 to 2015, she was Vice President of Hospital Operations for Kaiser Permanente in Oregon and Washington, where she was accountable for operations at 2 hospitals and its networks and ambulatory surgery centers. Before joining Kaiser Permanente, Susan served in several leadership positions at Fairview Health Services, which is a 7-hospital system based in Minneapolis. And there she was responsible for strategic service lines and regional surgical services. Before that, she was Director of Provider Relations and Contracting at Vivius Incorporated, which is a venture capital-funded startup. Susan, although new to Seattle, is already on a number of local boards, including Challenge Seattle, the Seattle Chamber, and the Washington Healthcare Forum. She also serves on Governor Inslee's Career Connection Washington Task Force. Kaiser Permanente, and Susan will share more about them in a moment, is obviously up to some very exciting things here and is committed to helping shape the future of healthcare. They are recognized as one of America's leading healthcare providers and not-for-profit health plans. They were founded in 1945, and Kaiser Permanente has a mission to provide high-quality, affordable healthcare services and to improve the health of their members and the communities they serve. We are delighted to have with us to share a little bit about healthcare and Kaiser Permanente, Susan Mullaney.
All right, well, good morning, everybody. It is great to be here with you. Here's the clicker. So I want to start off, thanks, Chip, for having me. So Chip called me several months ago and said, could you do this? I was so delighted to be asked. And what I've discovered is between Chip and Phyllis Campbell, you really can't say no to Washington State University alumni. It's like impossible. And what I thought I would talk about this morning is I thought we'd have some fun with this. I've got a couple of cool ads I'm going to show you from Kaiser Permanente. But we live in changing times, and universities and healthcare have a lot in common. Changing times, big challenges, big opportunities, and how do you deal with that from a leadership perspective and just from a business perspective. Getting ready, though, to come here this morning, I was doing my homework on Washington State University. And I've been in the Seattle area now for a year. And I was just telling my colleagues at my table that I am so impressed with the alumni from Washington State University. Everywhere I go, it's so strong, and it's very impressive. And you and us at Kaiser Permanente share a lot in common. We're both very proud organizations who've been around for a long time and plan to be around for a very, very, very long time. And so I wanted to first start off by congratulating you on opening the Floyd College of Medicine. That's amazing. And that falls in the category of being bold and audacious. It's a lot to take on a medical school. I love the mission of that medical school. Chip and I were just talking, it's not just another medical school. This is a medical school with a real mission, which is to recruit a diverse student body, that matters, and to make sure that as you're training that next generation of physicians in the world, they're going to go back and serve communities that are really underserved. That's a big issue in this country. So I applaud the bold thinking. I think that that's fabulous. And we do have a lot in common because we, Kaiser Permanente, we're going to be opening our own medical school in Pasadena, California in the fall of 2019. We'll have a student body of about 45. It'll be roughly 200 once things really get going. And we too are taking a slightly different angle on it, similar to what you're doing, but our twist, because really what makes us who we are is the fact that we have world-class clinical care for individuals, and we also manage the health of populations second to none. So any physician being trained in our new medical school will be trained in 3 areas. Medicine, because we want world-class physicians, and we have them. We have 22,000 of them. Leadership. If you are a frontline physician, even without a formal leadership position, You are a leader in our organization. And population health. So there'll be formal training in that and public health policy. So that's our twist on it. So we share a lot in common, and we'll have to keep in touch as that evolves. I think, I wanted to start the talk this morning with who we are, because I think that matters now more than ever. And we have been around for 70 years. We'll be around for another 70 plus. We're a very proud organization. And I don't know if you know the Kaiser Permanente story, but you're looking at the magic of who we are. This is way back in the beginning. To the right is Henry J. Kaiser, famous industrialist in the 1940s. I could tell you a lot about Henry J. Kaiser, but here's what matters the most. He was brilliant, an engineer, but also, as importantly, he was an incredibly altruistic person who was a great world citizen. He, a year before the United States got into World War II, had picked up that banner and that we need to intervene because what's happening overseas is really dangerous and the whole globe needs to unite around that. He actually, even though he's a really busy guy, chaired a national drive to collect and provide clothing for refugees who had suffered under the Hitler regime. So he's this incredibly altruistic man who had a bold vision for what the country should be and what the business should be. He is part of the reason why we won World War II, because the big challenge back then, as we were late entrants to that world war, was how quickly can you build up enough of an army to fight that war. So he's the guy who figured out it took 45 days to build a Liberty ship. He figured out with his workforce how you could take that 45 days and make it 4 days. And from there, history was made. And that's a big reason why we were so successful in World War II. So he's someone who had this bold vision for, he was basically a person who didn't believe in the status quo, who believed that the impossible was possible and would find ways to make it happen through drive, through ingenuity, and also through his belief in people. And I'll circle back to that. Standing to his left, this is the secret sauce of Kaiser Permanente, is the young Dr. Sidney Garfield. This is where prepaid medicine in this country all started. So Henry J. Kaiser, he had these huge shipyards. And he had a fundamental issue that he needed to keep his workers healthy. He needed to treat them when they had injuries. And he joined forces with this young physician, Sidney Garfield, and said, could you help me out on this front? And Sidney is actually the person who, and he was a great innovator, came up with this whole concept of prepaid medicine. So you give me money, I'll take care of you, I'll keep you healthy. If things go seriously wrong, I'll take great care of you. And for a nickel a day, the workers in the shipyards, in Kaiser's shipyards, could be treated by Dr. Garfield and the other young physicians who worked there for another nickel a day. This was Sidney's idea. They could provide care for that worker's family and keep them healthy and keep them from getting sick. So he's actually the creator of healthcare versus sick care. And so those two joined forces, and it was so successful, that was the beginning of Kaiser Permanente. And I'm going to introduce you to Gladys Theus. So this young woman was a welder in the Richmond, California shipyards. So Henry J. Kaiser, way back when, was a big believer in diversity and inclusion. We had women, we had people of color staffing those shipyards, especially as more and more men were sent overseas. She was a master welder in those shipyards. She created those Liberty ships that won World War II. Henry Kaiser and Sidney Garfield were, I think, one of the first in the country to have desegregated hospitals. And the folklore in our company is that somebody came forward to, I think it was either Sidney or Henry Kaiser, it doesn't matter who, they were both of the same mindset. And there was this big brouhaha about let's have desegregated wards in our hospitals. And this was back in the day when you might share a room with several people. And their response to that was, well, Why would you provide a lesser standard of care to somebody just because of the color of their skin? No more. And from there we went. So that's who we are. That's in our history. We're a company that's all about diversity and inclusion, a belief in people. Henry Kaiser believed in his people. So all of our business leaders in this room, that is part of his success story. And his people knew it. He was a huge fan of the people who worked for him. That's why he went out and found Sidney Garfield and said, can you keep my people healthy? And from there, greatness was born. And so those were our very modest roots way back when. And now here we are. We're a very proud and a very humble organization. We are one of the largest healthcare organizations in the country. We are incredibly proud of the fact that we're in the top 5% in the country for quality outcomes that are powered by 22,000 amazing physicians and 55,000 roughly incredible nurses and these big clinical care teams that surround them. I love the fact that we bring over 100,000 new lives into this world every year, 105,000 babies. And we are known, we're number one in our industry for customer service. J.D. Powers ranks us number one year after year after year. So number one in quality, number one in service. And the secret to our success is that we can do all that, provide you with world-class clinical care, and do it at a price point that is affordable. That's the big issue in our country. No matter what you're hearing from Washington, which is something different every day, the big deal in this country is how can we make healthcare affordable and not compromise on quality? A side note, you're going to hear, now there's a bill that's been resurrected around having a single payer system, and that's mainly happening in California. There's a big push for that. We believe in competition. We think competition's a good thing. We think single-payer systems don't necessarily promote that. So there are lots of different ways to solve for that issue of how do you provide world-class clinical care and make that affordable for people across the country. And that is what we're working on relentlessly to figure out. The Affordable Care Act, so I want to be really clear about this because you're hearing a lot about it. All that did was provide coverage to people in the country. We live in the wealthiest country in the world. We have 20 million people now who benefit from the Affordable Care Act, and we have 30 million who are still uninsured. Do you know that in the state of Washington, 50% of the babies born in this state are born into the Medicaid rolls? That has huge repercussions for us. That's something that needs to be solved for. So we thought that the Affordable Care Act was imperfect and just the first step out and critically important. The real reform that needs to happen is really about how you financially incentivize the healthcare system. And real reform needs to happen with healthcare delivery and how it's structured. So a little bit on that. We thought, we go around and we say, hey, we're this wonderful integrated healthcare system. It's us, it's this amazing group of 22,000 physicians. You give us money, it's all under one roof. We take care of you, we keep you healthy, we keep you well, and then if things go seriously wrong, like cancer, like a heart issue, you couldn't be in better hands. And it's kind of boring to try to explain that to people. So luckily we have an amazing advertising and marketing team, and they came up with this ad, and we launched this when we launched earlier this year, and I'll talk about KP Washington in a moment. And I think this best describes us and actually projects our personality and who we are. So it's a brief ad, and I'll run this for you.
When you have doctors working as a team for your health, you get the care you need to help you thrive. We're Kaiser Permanente, and we're here to care for everybody in Washington. Visit kp.org/HelloWashington to learn more.
Isn't that fun? I love that ending. So that's what makes us so successful. Okay, so we have how our model works is we have our physicians lead quality and make all the clinical decisions in our organization. Okay, we have one monolithic electronic medical record where we have all of your data, so we know what's happening with you. We should know before you do if you're getting sick and can intervene early. And that electronic medical record is loaded with all of the latest and best evidence-based medicine and practices so that we can be on the cutting edge of how to treat you and keep you healthy and well, or how to treat serious conditions. That's how it all works. That's it in its simplest sense. That's why if you are with us, for instance, if you're a female and you have a breast cancer diagnosis, because we do such a great job with early detection and then treatment and treating only what is really needed and using the latest evidence-based protocols to treat you, you have a significantly higher chance of surviving that diagnosis, so that's good, right? So if you're the one with cancer, you want to know, I'm going to live. And then secondly, you'll spend about a half the amount of time receiving chemotherapy and radiation therapy than somebody who's in a non-integrated system. And if you pause and think about that for a moment, if you're the one with cancer, now I've got 2 young kids at home, so what I would be thinking, and I love my job, I love what I do, I'd be thinking, how can I get back to my normal life as quickly as possible? To me, having half the time on chemotherapy and radiation therapy and still having a much better chance of surviving sounds like a winning combination to me, right? And think about the costs that we're saving in doing that. That's enormous. And so that's what makes us work at our most fundamental. So that's who we are. That's who we have been for 70 years. That's who we're going to be for the next 70 years. When you think about all the things that are happening in healthcare, and I was asked the other day by a very nice reporter, how do you sleep at night with everything going on? Because it has been wild and woolly times. For us, that's easy, because even with all these changes happening in healthcare reform, it doesn't change how we show up and do what we do. So we are true to who we are. We're not trying to be anybody else. We're us. That's us, boiled down to our essence. And though, the most important thing is that we are evolving, though, with our customers to meet their needs. So it's a little bit paradoxical. We're going to be who we are and remain true to that. And we're going to evolve and change with the times. We're going to innovate. We're going to do things differently so that we can be ahead of meeting your needs as a customer, whether you're a business who needs us for health insurance for your employees, a member, a patient, you name it. So we launched in the great state of Washington earlier this year. We acquired Group Health Cooperative, which is another great organization with a very proud history. And we went live as Kaiser Permanente Washington on February 1, 2017. And I'm here with my colleague, Dr. Steve Tarnoff, the CEO of the medical group, and we had a lot of fun doing this and pulling all together. And now that means that Kaiser Permanente, we cover roughly 12 million people across the country. We're a large, growing organization. We're now up and down the West Coast. We're in Colorado. We're in the Washington, D.C. area. We're in Hawaii. We're in Georgia. We'll continue to grow. Now we're in the great state of Washington. And Steve and I have spent a lot of time thinking about, okay, how do we need to bring our best fundamentals forward and then grow and change based on what our customers need from us. And so what we've been focusing on, it's such a fun opportunity to come in and to be able to build and grow. We're bringing in over $1 billion worth of investment in this market. We just announced yesterday that we've initiated a $400 million project to completely renovate our campus on Capitol Hill and make that a specialty center second to none. And we're going to go live with a number of new clinics throughout the state of Washington over the next 22-month period. That's our first step out. We're investing a lot in the digital space that we can better meet your needs in that area. And that I'm here to tell you is not going to be enough, though. We're going to need to think long and hard about what is it that you're going to need 5 years, 10 years down the road. And that's the space that we want to be in, and that's where we're going to put a lot of our time, a lot of energy, in our focus, because there are big trends happening. So today, Kaiser Permanente Washington, we've got more clinic sites than anybody in the state of Washington. We're going to add to that. We believe that more and more care is going to move to the digital realm, right? And I'm looking at all these. This is a table that's full of students, isn't it? Right? And so if you could just get all of your healthcare on your device, wouldn't that be great? So you've got to solve for things like that, right? So we see that happening, right? So how you work with technology to better meet your needs, those are problems that we're solving for. We see those as huge opportunities, and we're set up to solve for them. Data is a big deal. How do we work with data to keep you healthy and well as an individual? How do we work with data to keep populations healthy and well? Little fact, so what does that mean in a practical sense? We implemented a protocol in our hospital system. We've got 39 hospitals that we own and operate. And we implemented a protocol in our hospitals that could detect that if you were starting to go south clinically, we would know that, and we would prevent you from being admitted to an ICU. We saved thousands upon thousands of admissions to ICUs, which practically means that if you were in a hospital, you wouldn't want to end up in an ICU. We saved lives, and we saved a lot of money too as a result of that. That's passed back to the businesses who count on us for their health care. So we use data today in a lot of very robust ways. My daughter Evelyn, who will turn 9 next month. When I was back in Portland, Oregon, this is me experiencing our system firsthand. I got a call from our pediatrician, Dr. Wendy Lynn, who is amazing, out of the blue saying, you know what, the latest protocols just came out from the Academy of Pediatrics. Your daughter might be at risk for a heart issue, a heart rhythm issue. I don't think she's at risk, but we just updated all of our protocols, so we're going to have you come in, have a consultation with a pediatric cardiologist, have an echocardiogram done, blah, blah, blah. And I hung up the phone, and I had 2 reactions to that, right? As a mom, I'm thinking, oh my gosh, is something really wrong? I want to get Evelyn in right away. And then secondly, I'm thinking, I wasn't even thinking about this, right? My phone rang out of the blue. This is our system at its best, which is why we are so strong and have such a great value proposition. We are incentivized to keep you well and to do things like that. So that's a little bit about us. So that's who we are, that's who we're going to be forever. And that's going to change dramatically in terms of what are the vehicles and leverage points that we have to even make that more robust and more impactful on people's personal lives and on the bottom line for employers and the government who depend on us to provide great coverage and world-class clinical care to the subscribers that we take care of. I'm going to end on this note, Chip, and I can't emphasize this point enough, that so while we feel good about being #1 in the country by J.D. Powers for customer service, you're all smart business people. You look at those J.D. Powers ratings, and you know that healthcare still remains a laggard for other industries in terms of how well we perform based on customer service. Steve and I look at that all the time and think about how do we get out from under that. Healthcare, for a long time, I'm going to be critical of healthcare now. Healthcare's been, we're all about us. We can tell you a million reasons why we can't make something happen. It's got to be on our terms. Those times are changing. The healthcare organization that will prevail, and we plan on being that healthcare organization, is going to be the one that is so customer-centric, the world revolves around that. Everything should be designed to meet your customer's needs, period. And if you don't figure that out, somebody else is going to figure it out for you. And so everything that we're doing is meant to take us to that next level. We already do a great job of that. We're already #1 in our industry for how well we do that, and that's not enough. So we need to take it to that next level, and that's what we're pushing ourselves to do as well. And so I'm going to end on this note because I think that this is an ad, and I'm giving you a preview of an ad. It's going to launch in a few days, so you get the sneak peek here. I think that this captures that so well, our commitment to designing everything we do to meet people's needs. It's not about our system, it's about you, and about the incredible specialty care that we provide within Kaiser Permanente that is second to none. So I'm going to roll this clip, and then I would love to open it up for any comments or questions, and then hand it back to you.
So, Greg, it's a lot to take in. I know. But the good news is that we've caught it early.
But we caught it early.
Exactly.
Guys, I know that's hard to hear, but the doctors caught it early.
Hi, Blake. My dad has cancer.
And I know how hard that is to hear. But you're in the right place.
And Dr. Pascal and her team, they know what to do.
They know what to do.
The doctors know what to do.
So here's the plan. First off, we're going to give you all this.
So that focus on you and on our customer, it manifests there in a very real way, right? We're not the healthcare organization that's going to be out there beating our chest about ourselves. Everything is going to be about telling that story from the people who we're actually here to serve. And so I think that was a perfect encapsulation of that. So my main messages this morning are I couldn't be prouder to be here, to have Kaiser Permanente operating in the great state of Washington. You'll see a lot more from us. We're going to really build and grow and double our size over the next several years. I'm really excited to be formally connected with Washington State University. What a great university, and hopefully we're going to come together in more powerful ways to help one another be successful. And when you're leading your business, when you're getting into the business world, it's always about customers first. Stay true to who you are as an organization. That's what makes you special, versus the Me Too strategy. And you always have to be thinking about what's around the next corner and changing to lead and keep up with the times. And you have to have some fun, right? It's a short life. So thank you very much for having me this morning. Okay. And I'd love to hear from you. So comments, questions? Yes.
If you were czar for a day, and I know it's a complicated question, what would health insurance look like in this country?
Oh, I don't think health insurance is the thing that's broken. I think people need coverage. If I were czar for a day, what I would do is look at how do I change the financial incentives so that the healthcare systems, the hospitals, we've got 5,000 hospitals in the country, all the physicians in the country, how do you line up incentives so that they are motivated to prevent disease and not just treat it? And we have amazing hospitals across the country and incredible physicians. How they're paid today is to really focus on when things go wrong versus really being upstream, working with data, figuring out ways to keep you healthy. So that is something that I would look at changing. I'll also tie it to something else too. It's interesting I don't know if there are other healthcare professionals in the room, but what we see all the time is that connection of education, poverty, and disease. So we get folks, here today coming to us who are morbidly obese, who've got big issues with chronic disease. And we can tell looking at our data. Dr. Eric Larson, who leads our research institute, and he and I work together. He's leading research and innovation for a company. He could stand up here and tell you that if you are poor, you will live on average 15 fewer years than if you are a middle income earner. We see that all the time in healthcare. And so if I was czar for a day, what I'd also change is really looking at how do we revamp our education system so that we could position people to climb out of poverty, have good paying jobs, and contribute in the workforce. That directly relates to health. It's fascinating. And that's something it's in this whole healthcare debate that's not been discussed. But you can really change lives in doing that. Have a much healthier population and save a lot of money. So I think about that as well. Yes, front row here.
Good morning. I'm Pat Butterfield from the College of Medicine.
Yes.
Kaiser Permanente is a global leader in environmental health in terms of delivering healthcare in a way that's green, environmentally sustainable, and reducing the carbon footprint. What's the future of this for Kaiser as we go forward in terms of addressing patient care, but also dealing with a crowded planet?
Yeah, so a great point and great question. Our rule now within Kaiser Permanente is, for instance, any new medical building that we build, any hospital that we build, and we do a lot of that, has got to be Gold LEED certified, if not Platinum LEED certified. I had the pleasure of opening a new hospital back in Portland, Oregon, Kaiser Westside Medical Center, and we, just by using that as a design principle and by allowing in natural light and doing all that, we cut the energy intake that hospital used by over 30%. And we got really creative about how we used rainwater, because there's plenty of it here, things like that. So that's something that we take seriously. We're a good global citizen in that sense. And you see that manifest directly in how we design our facilities and how we run our supply chain management overall. So we're deeply committed to that and do that today, and we'll continue to.
Hi, Susan. Alex Peach from WSU. Group Health was one of the more storied brands here in Washington State and Puget Sound region in particular. Can you talk about how Kaiser Permanente is working with those longtime group health customers and patients and integrating your brand with them? Yeah,
absolutely. So it was, Group Health was a fabulous organization and an incredibly proud organization. So the stakes were that much higher in how you actually come in and bring together these two incredible organizations, right? And my punchline on that is, because I could talk to you about that for the next half hour in terms of how we did that, we were really deliberate about being very intentional about honoring the incredible culture and legacy of Group Health. Group Health was an organization that we adopted their best practices for a long time. They'd adopt ours, we'd adopt theirs. Superb organization. And so then the opportunity and the challenge became, how do you honor that so that as people came into Kaiser Permanente, they felt really good about that and really proud about that. So we really doubled down on that, and we're very thoughtful, deliberate, and had clear plans and took clear steps around making that happen. And fast forward to today, one of the things I'm most proud about, because if you don't have culture, you don't have anything. When we survey our employees and our physicians all the time, we do that every month. I've got our leader of HR here. She's looking right at me. She knows the data better than anybody. And we see that over 90% of our people, whether you're a physician, frontline staff member, manager, whoever, feel incredibly proud to be a part of Kaiser Permanente and are saying, how can I contribute and get involved in all that's going on? And it's because we put so much work into a culture plan, I'll call it shorthand. That was as important as any of our business plans, and that's how we treated it. So that was no small undertaking. Yep.
Hi, Susan. Thank you. I'm Kevin Harris with the William D. Ruckelshaus Center. We're organizationally under WSU Extension. You made some reference earlier on to the social and behavioral determinants of health. Those are the issues and factors that impact health outcomes beyond the medical clinical bubble. And I'm just curious, does Kaiser have examples of how you work with community leaders within these social determinants, whether it's criminal justice and education and transportation, all the other things that impact health outcomes beyond clinical medical? Or is that a challenge for a traditionally vertically integrated organization like Kaiser?
Yeah, so how do we get upstream and actually address those social determinants of health? That's a terrific point. So it looks like this in our organization. We take 3% of our top line revenue, not our margin. This is how committed we are to this. 3% of our top line revenue, and we put that right back into what we call community benefit. So roughly here with the size of our organization, this year we'll spend $60 million in Kaiser Permanente Washington. As we mature and grow, it'll be more about $100 million every year that we're putting back into the community. What does that mean? That means that you cover the fundamentals like people who don't have insurance, and there are plenty of them, or who are underinsured. Half of the bankruptcies in this country are because people get sick and can't afford to pay their medical bills. They lose their homes, they lose everything. We take money, and we'll spend about $30 million this year to provide care to people who can't afford it. We consider that table stakes, so that's still really downstream when you think about things. Then we go upstream, and we put, so in Kaiser Permanente Washington, we will be putting money into the public school system. We are bringing educational programs or supporting them. We don't do things on our own. We get out and we find great community partners who do it really well, and we fund them and say, go and do. And that's how we do what we do. So for instance, we're funding a program with Seattle Children's Theater to bring a program to 20,000 public school students this year to educate them in fun ways that they can actually relate to about bullying. We're funding parks and play spaces across the state in underserved areas, poor areas, to make sure that kids and families have access to healthy activities that will help them in the long run. We are looking at, and I was honored to be asked to serve on the governor's task force for career-connected learning. What is that? It's really looking at how do you find ways to plug people into here and now workforce opportunities in the state. So Amazon has 6,000 jobs open, 6,000 really well-paying jobs. And they cannot fill those jobs with people from the state of Washington. It's not an educated enough workforce. So we've got common ground here, right? So, that's a great problem to solve for. And that actually solves for healthcare issues. So how could Kaiser Permanente really get in that space and help support apprenticeships and internships and so on and so forth? So we put a lot of money into that space, and then we direct it in ways through community partners where we know that we'll have a long-term impact. One last note on that too is we're looking at how we will spend a lot of money here. So we'll spend over $1 billion in this market. How you spend that money really matters too. So we have a strategy in the company. So this isn't community benefit. This is just really being thoughtful about how you spend your money, where we will work with minority-owned businesses to employ people in that fashion to meet our business needs. And when we construct new facilities, we look at ways that we can provide jobs in the local community by doing that and get people back to work who might not have access to that. A great example of that was we opened a new medical center in LA, in a really poor part of town, South Central LA, where poverty, crime, drugs, you have it. I don't think it gets much worse. And when we built that facility, we intentionally found ways to put people who couldn't get a job back to work. So these are ex-convicts who are unemployable. And we said, we're gonna figure that out. You can have a job as a groundskeeper. You can do X, Y, or Z. And we'll provide you with healthcare too. And I'll never forget our CEO, Bernard Tyson, told me this story, and it moves me to this day, where he met this gentleman who fit that bill, gave him a job. He had really bad hypertension, number of other issues, and that was all turned around. This guy turned his life around. He got really healthy. He had a job, right? And Bernard shows up on site and he says, hey, great, our fabulous physicians, got your diabetes and your hypertension under control, isn't that great? And he said, Mr. Tyson, my blood pressure went down the moment you gave me a job. And I thought, yeah, doesn't that make sense? So we get really creative about how we put our money to work for us so that we can lift up the community. So great question. Thanks for asking it.
Hi, my name's Shannon Flynn. I'm from Microsoft. My question, I love what you've talked about as far as the community engagement and kind of on the national level. My question's more around the kind of worldwide level. Mm-hmm. So I've read a lot of studies that there's other countries that have much lower cost of healthcare. They do a lot better job of preventative care, even in really impoverished countries. Mm-hmm. And so I'm curious what kind of research or work Kaiser Permanente is doing to understand how some of those work and kind of opportunities that we have to incorporate here in the U.S.
Yeah, and those studies are true. And we look at that all the time. Why does it, cost half as much to keep people healthy and well in England or, what have you? The Scandinavian countries really do it well. And we study that. We actually we participate in an international healthcare fellowship. I went through it 2 years ago now, where I visited other countries to actually see how it worked. The punchline, though, is this, and I'll tell you what, and this is more Susan Mullaney talking right now, we can be so hard on ourselves as a country when we look at some of the indicators that tell you how healthy is your population and how much do you spend per capita. And we've got room for improvement. And I talked about, if I were czar for a day, the stuff I'd look at to solve that. I never lose sight of the fact, though, that we are the country who has done specialty care unlike anybody else, right? Just about all the major breakthroughs, not all of them, but the bulk of them have come from America, right? Cancer care, surgical care. I was just talking with somebody at the table. We had roots in common with the University of Minnesota back in Minneapolis. That was the birthplace of open heart surgery and heart transplantation and pediatric heart transplantation. And so we do stuff like that. And I would never want to lose that. When you get into some countries that have single payer systems, and there are only two, Canada and Britain, you don't have competition where you've got people working hard to figure that out. And we need that. I want to see those next breakthroughs, right? I mean, we'll look back on this day with cancer treatment 10, 15, 20 years from now and say, my gosh, can you believe we ever did it that way? We'll make such progress. And I think a capitalistic economy drives that. The problem is we need that. We also need to shore up how do we really do much better with preventing disease and then still be a world leader in treating it. So that's my personal take on it. I think you get into a dangerous place if you say all we're going to do is focus on prevention and that should be good enough because we're capable of more. My last note is I think the United States funds all the research for the rest of the world. When I was in New Zealand, so pharmaceuticals are in the newspapers all the time, and it's crazy how much money pharmaceutical companies make on bringing out the next generation of drugs, and they'll say, oh, it's because of all the research that we do. If you actually look at how they spend their money, most of it's on marketing. And so we fund their research for the rest of the world. New Zealand moved to, so if I were czar for a day, this would be fun to do. They moved to a system where they said, you know what, all of the drug purchasing is going to move through the government. And they set up the system called Pharmac. And if you're a pharmaceutical company, you have one person to negotiate with in the country of New Zealand, and it's the guy who runs Pharmac, who I met. And literally, their cost of drugs is nickels to dimes on the dollar versus ours. So that's an interesting space. I digress, but those are, don't get me started on New Zealand and pharmaceuticals. But, and you do need a capitalistic system, though, that motivates pharmaceutical companies to make money and bring forward those next big breakthroughs. So it's never going to be perfect, and I wouldn't want to lose sight of keeping that alive and well in the country. Yes.
Yeah, hi. My name's Pat Murphy, local small business owner, WSU grad, of course. I've been a group health member for several years, now Kaiser Permanente member. As a small business person in Washington State, though, finding insurance for my employees is extremely difficult. There are no small business plans really to choose from. So employees are asked to find their own insurance through private plans, such as group health or Kaiser. Very little competition. So you made the statement earlier, you don't think the insurance situation is the problem, that it's not broken. But in this state, it seems to be broken. So my question is Kaiser doing anything to address the need of small businesses in this state to find coverage for their employees?
Yes,
affordable coverage for their employees.
Yeah, affordable coverage, right. And so that's our goal. Our goal is to grow and have our care delivery system growing more and more throughout the state of Washington, so that we can provide not just the insurance, but the access to our brand of medicine in the state of Washington. When we do that, we know that we provide great clinical quality, a great experience, and we can also do it much more affordably, typically, than anybody else around. And that's going to take some work, that's going to take some investment to get us there over the next several years, but that is the goal. And you do need competition on the insurance side. Don't get me wrong. It's that's been the big issue with if everybody pulled out of the exchanges, right? And you're left with nobody in it except one insurer. Well, you know, the rates, if they're not competing with somebody, those rates aren't going to look great. So competition on that realm is good, and you also need really healthy competition among the healthcare delivery systems as well to make it work. We do a lot with small business. Small businesses are a big fan of Kaiser Permanentes. We've grown double digits with small businesses in the state of California over the past few years, and plan to do much more with that here to make it, it's the affordability issue, it's the cost issue, so that people can actually have coverage and afford their health care.